Hi there, my name is Blaise Bowling. I'm a remedial massage therapist at the Balmain Massage Centre, and today, at 24 weeks pregnant, I'm going to be showing you exactly how to use the massage pregnancy table that we have at our center. So here's what it looks like. There's a hole. Obviously, your bump would go right into the hole. We would be using this table at about 25 weeks. That's most suitable for most pregnant women, although that can change depending on your size, sometimes a bit earlier and sometimes a bit later. And it basically functions exactly as you would with a regular massage table, except it just allows an area for the bump to fit. So when we go to turn the client over, it's just as you normally would during a regular massage, except we need to fill the hole where the torso would fit and the bump would fit. So for that, we have a bolster. The therapist will walk the client through this, through the entire massage, and when turning them over, you simply fit the bolster into the hole where the bump would be, turn the client over as usual, and then just perform the massage with the client face up. Are you ready to begin, Louise?
Sure.
Great. I'll just have you turn face down. Thank you. So it would begin just like any other massage. First starting onto the back, if that's what you choose. And working in through the back, through the thoracic region, and into the lumbar, and most times into the glutes. Pregnancy is a time for a lot of change in a woman's body. Not only are you growing a child inside of you, but your body is having to catch up accordingly. There's a lot of weight that a woman's carrying in a short period of time, through the front, through the chest, and it's having quite an impact through the joints as well. It's a lot more weight to bear. So you're often going to see a lot of tightness through the thoracic and the cervical regions, and also the lumbar region, right in through the lower back. It's going to have a lot of big changes, especially in the last trimester, as the hips begin to widen to allow the baby to move its way through the birth canal at the final stages. There's a lot of muscle attachments through the lower back and into the glutes that are affected by this. And a lot of the weight of just the uterus itself can actually weigh down through the woman's body and can create some sciatic nerve pain and just a lot of tension through the joints and a lot of stress through the joints. A lot of women around second trimester also experience cramps all throughout the legs. And so massage can be a really great way to alleviate these cramps, deal with these changes through the lower back, and help the neck and the upper body support the weight that is now being held in a very short space of time. So for pregnancy massage, we would usually just use a base oil and perhaps a lotion. We can use essential oils. Some are contraindicated during pregnancy. So we would generally use just a lavender base oil, but aromatherapy is welcome. You just need to discuss that with your practitioner to begin with. All right. So pregnancy massage, when you're face down, is just like any other massage, except there's a little area for the tummy to fit comfortably in. And for the short hour or hour and a half that the belly's in, there's not much stress on the frontal ligaments of the woman's body. It's also quite a lovely change for the baby as it's hammocked and well supported in the mother's tummy and not touching the spine. It's quite a comforting time for mother and for bub. What we generally do during a pregnancy massage when we have the client turn over is raise up onto all fours to wrap the sheet around them while we then add this bolster into the little tummy hole. All right, Lou, I'll just have you get up onto all fours and wrap the sheet around you. Take your time, please. We'll also adjust the legs in order to support the lower back by placing the pillow directly under the knees. Wonderful. This is just the same as in a normal remedial massage. Most pregnant clients after 25 weeks find it somewhat uncomfortable to lay directly on their back. In this case, we would ask the client if they would prefer to have a bolster underneath their right hip, alleviating the pressure of the baby laying up against the spine and stopping any circulation to the legs, which often happens if the baby is quite large or if the woman is in any way uncomfortable. So I'll just have you lay slightly to the back. Wonderful. Is that comfortable for you?
That's great.
Great. And just like in a normal remedial massage, we would be covering up the eyes to allow the client to relax during the rest of the massage.